The opinions expressed on this program are solely those of individual participants and do not necessarily reflect the views of either Spectrum Generations or Time Warner Cable. Mature Lifestyle is made possible by Hollywood Slots of Bangor, where every player's a star, and by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
I like to think of myself as a nice, middle-aged lady who's owned by a pair of nice, middle-aged teacup Yorkies named Jelly and Gizmo. So you can imagine how shocked, how surprised I was as I prepared for this show and found out that my dogs are not middle-aged. They're seniors. The only thing worse would have been if I found out that I am. Welcome, I'm Dot Freeman. This is Mature Lifestyle, and back by popular demand is Dr. Eleanor Sabine of the Lakeside Veterinary Clinic in Oakland, Maine. Welcome, Ellie.
Thanks, Dot.
So far, so good, huh? Do you have any middle-aged dogs at your house?
No, I have a family of youngsters. I'm still raising children. Yes.
Dogs and kitties, or dogs only?
Dogs and cats are all quite young. Everyone's under 5.
Okay, under 5. Well, just a few facts for everybody. There are 77 million dogs in the United States. 1 in every 5 households in the United States owns at least one dog. And there are 94 million kitties. 1 in every 3 American households has at least one cat. And in Maine, in your practice, is that about right? Do you see about 2 in 5 households with dogs and 1 in 3 with cats?
Well, you know, interestingly, Dot, I just was looking at an AVMA article last night that said that Maine is 6th in the national percentage of households that have pets.
Mm-hmm.
And they actually quoted a statistic of 70% of households in Maine have a dog or a cat.
Is that right?
Yeah, which I thought was pretty amazing, and I'm glad to be here.
Yeah, it's good for business, too. I did look up some of the statistics on the average amount that Americans spend at the vet, and I'll go over that with you later. Let's talk about pets. I think we all know that they are good for our health because they cause us to walk and feed them and interact with them.
Absolutely.
And they're also good for kids.
I would say, yes, definitely good for children who have more distractions, I think, but it always makes me feel good to help someone who's older, you know, than myself, which is a dwindling number, who enjoys their pets, because it certainly does give them companionship, a reason to get up in the morning, that warm, fuzzy feeling on the couch at night, and there's definitely lots of research that have shown that pets are very good for people's health, particularly seniors or people living, you know, empty nest syndrome.
Sure.
Folks.
And as we get older, our pets are aging right along with us.
That's true.
And we have some of the same kinds of health issues. And the point I was making in the opening about my dogs,
right.
They're 7 years old,
yes.
And so rule of thumb, I know it varies for a large breed as a small breed in
right.
terms of when they're considered to be a senior.
Right.
But rule of thumb for a dog is 7 years of age, and for a kitty is 10 years of age. Is that about right?
That's pretty standard, Dot. I would say give or take a year. That's right on.
Yeah. Now, what do you see? What kinds of things are the characteristics of normal aging that you see in dogs and cats that come to the clinic?
Well, let's take dogs first, I guess. You know, normally what I'm looking at are animals that are slowing down. For various reasons. I guess they're not as active as they were. They have, you know, some hearing or vision issues coming on. The big one, I think, Dot, is arthritis. You know, and people don't realize that their dogs, or their cats too, have some pain because, you know, the dog isn't complaining and standing up and holding his hip, but he might be, for instance, slow to go upstairs or downstairs. He may be slow to get up, and once he's up, run around and feel great, but a little bit stiff that night when he goes to bed. Animals who all of a sudden always get on the couch and the bed can't or don't,
Right.
you know, and you might notice them stop and wait and kind of posture themselves to jump up. And certainly it's very frequently that on exam I find some significant pain that owners didn't even know was there in the hip or the back, sometimes the shoulders, just like us.
Right.
You know,
Are owners typically surprised when they find
Often,
out, and I'm sure
yeah.
they feel badly when they realize their dog has been in some misery and they didn't know it?
Or, you know, not misery so much, but just like with us, aches and pains and stiffness. And the muscles don't work quite as actively as they used to. And,
Right.
you know, joint pain and muscle loss go hand
Well, what
in
about
hand.
that loss of muscle mass? Is that something that the dog may not necessarily be thinner, but it has a more
Absolutely.
concave look to
In
it?
fact, they may actually be overweight, which is another sad thing we see as the animals age. Because they're not as active, they tend to get heavy, and that's a double whammy for joint pain, you know, to carry that extra weight, and then also to have the joint issues as well. So what we may have is a little round dog who looks quite fat, but if I start to palpate muscles along the back or in the legs, they're quite thin.
Yeah.
So
The
you
muscle
know,
tone isn't
absolutely
good. What
And
about things like diabetes when you say they get overweight? So do you look for a dog that's
very
drinking
common
more?
as well. Yes, well, you know, let's look at the biggies, I guess. You know, beyond arthritis, we have heart disease in older animals.
And how does that manifest? What should an owner?
Usually, exercise is hard for them. They'll start to cough, or they don't want to go as far. Sometimes people notice a cough, you know, at night. By the time they're coughing, though, things have often kind of gone ahead. And then we have just pulmonary or lung issues, just like people get chronic obstructive disease. A lot of older pets will cough from heart disease and or lung disease. So that's very common, just age-related issues. Then you have all your endocrine, you know, your hormonal issues like diabetes, where they could drink and pee a lot. They do tend to lose weight very quickly with that.
Yeah.
And there's other hormonal issues too. I always look for thyroid disease in older pets is very common.
Yes.
And can lead to very similar signs to the diabetes.
And how do you check for that? Is that a
It's very
blood
quick
test or an
blood test.
imaging? A
Very
blood
quick
test.
blood test, yep. Right in the office that same day. It's easily treated, thyroid disease. So something that, again, they don't say, boy, I'm tired today. Oh, I think I have a bit of a headache. Boy, my back hurts. But all those things can be related to thyroid disease that once treated, people notice, wow, he's like himself again, you know. So, and then we have Cushing's disease,
Yes.
a disease also of the hormonal system that affects the adrenal glands. Also, big drinkers, you know, weight gain, but muscle loss, very, very common. Big bellies, can't jump on the bed, not because they're painful, because they're weak. Their muscles are atrophying.
And what about cataracts?
Very, very rare, actually. You know, we see cataracts in dogs with diabetes generally. What often people ask me is, oh, does my dog have cataracts? And it's not a cataract. It's what we call lenticular sclerosis, or thickening of the lenses. And it's not truly a pathology. It's a normal old age change. So you might be looking at your dog on a bright sunny day and see blue in the middle
a
of the
bluish
eyes.
look.
It's not a cataract. 90% of the time, it's not a cataract.
So there's a thinning of the iris.
The iris thins, but the lens thickens. The little, you know, the little lens that actually focuses,
Sure.
especially in the middle, gets very, very thick and kind of white, which can look blue in certain lights. So they have a hard time seeing through the middle of their lens. They see better around the side of that little thickening in the area.
Right.
So they may actually see better at night.
Well, what about cats?
Cats generally develop, you know, very similar issues to dogs. Their big issues are thyroid of the opposite version. Dogs become very low thyroid, tired. Cats, one of the three biggies in cats is hyperthyroidism. So their
how does that
thyroid gets
manifest?
overactive. They're like jittery and they can't sit still. They tend to eat like pigs and lose weight. And they tend to eat and steal food. They're very jumpy personality changes. So they have the opposite of the dogs. They're almost too jittery, and they start to lose weight rather than gain it. Diabetes is common in cats. It's the second probably of the three biggies with cats, older cats. Diabetes mellitus, drinking, weight loss. And the other one that unfortunately is very common in older cats that we don't see as much in dogs is kidney issues, kidney disease, kidney failure. And that's very insidious. It comes on slowly. You know, the cat's losing a little weight, they're drinking a little more, and often by the time I see them, they're throwing up because their kidneys are failing. So those three biggies, diabetes, thyroid, and kidney disease probably constitute the vast majority of older cat issues that I see. We try to encourage geriatric screening every year doing blood work just to see, because we can pick these things up fairly early. We can treat them more aggressively and more successfully. So, definitely a lot of these issues, heart disease, lung disease, and then those three I mentioned in cats are very prevalent in older pets.
Okay.
And you may not notice, as your pet, you may not notice these changes. That's where an exam, so many people don't understand. Like when we do the exam.
So at age 7 for a dog, you're starting to give that annual geriatric exam.
I encourage
for
it. Well,
a cat at 10.
we do annual exams on everybody, Dot, but I would say for a geriatric even, biannual exams are becoming the standard. So every 6 months to look for weight loss, muscle loss, pain, vision changes. Dental disease is another one we haven't talked about, which is huge in older pets. People tend to not look in their pet's mouth because the pet doesn't like it and it smells bad.
Yeah.
And there are some real horrors. If it was you or I with that mouth, nobody would talk to us. So,
well, we want people to stay tuned and talk with
Yeah.
us some more. We're going to come back in just a moment with Debbie Berthume, because she is a certified dog trainer, because when you have a dog, you want to make sure that it is well trained, whatever that dog's age. Stay with us. We'll be right back.